I am a mother whose daughter has identified as transgender since the age of 14. I am here today because I love her and because I care deeply about her and other kids who identify as transgender, who are not getting the compassionate care that they need and deserve. Affirmative care leads directly to putting children on the path to medical transition with little chance of turning back. If you take your child to a clinic to seek help, affirmative care means the therapist must follow the child's lead. The professionals must accept a child's gender identity. In fact, this is the law in many states. Under conversion therapy bans, questioning a child's gender identity is now illegal. So if a little boy is 5 years old and believes he is the opposite sex, affirmative care means going along with his beliefs. Parents are encouraged to refer to him as their daughter and let him choose a feminine name. Teachers are told to let him use the girls' bathroom at school. Therapists will reassure parents that social transition is harmless and reversible. Is it really harmless to tell a child who still believes in the tooth fairy that he is the opposite sex? Isn't it quite likely that this child is just confused? If a 10-year-old girl is uncomfortable with her developing body and suddenly insists she is a boy, affirmative care means blocking this girl's puberty with powerful drugs. Doctors will tell parents this is a perfectly safe and reversible way for her to explore her gender. Affirmative care does not help this child get to the cause of her discomfort. Medicating her with these drugs is not safe. In fact, her future fertility, sexual functioning, and bone development may be negatively impacted. Once the teenage years begin, affirmative care means giving young people cross-sex hormones. Girls as young as 12 are prescribed testosterone for lifetime usage, while boys are given estrogen. These are serious hormonal treatments that impact brain development, cardiovascular health, and may increase the risk of cancer. There are no long-term studies to prove this is necessary, safe, or prudent, while there are many known hazards to using these same hormones when medically treating adults. Jazz Jennings is an example of affirmative care. Jazz was born a boy but raised as a girl since the age of 5. He was treated hormonally since age 11. Last year, at the age of 17, Jazz had surgery to remove his penis and create a simulated vagina out of his stomach lining. After surgery, Jazz's wounds began separating and a blood blister began to form. An emergency surgery was performed. According to Jazz's doctor, as I was getting her on the bed, I heard something go pop. When I looked, the whole thing had split open. This is a medical experiment on a child that has been playing out on television for the past 12 years. No one knows what might happen next. There are teenage girls undergoing radical hysterectomies in the name of gender identity. It is not acceptable for doctors to remove healthy limbs from children, so why is it acceptable for doctors to remove healthy reproductive organs from children? I am here today not just because I care about children who identify as transgender, but because I also care about their parents and other family members. Parents are doing everything they can to help their kids lead healthy, happy, and fulfilling lives. Yet when parents seek out experts for help, they receive a one-size-fits-all narrative that has no basis in science, common sense, or compassion. Why not help children learn to love the bodies in which they were born? Transgender identifying children need our compassion and they need our help. They need responsible adults to gently question their beliefs, not blindly affirm them. They need proper therapy and guidance, not drugs and surgeries. Please speak out for these children.
Tu donativo económico nos ayuda a seguir combatiendo lo políticamente correcto. Para más contenidos políticamente incorrectos, te invitamos a suscribirte.